Okay. So cookie question from last week. You all did a good job with that assignment. There really was no right or wrong answer, to it. But and if you didn't get what I'm finna go over, you didn't get counted off on. So just remember that. So cookie question. So the best way to handle the alpha cookie would have been to hold it in the hand. It is radioactive. Um, but as long as we keep it away from vital organs, we will be okay. The best way to handle the beta cookie was to put it in a briefcase. It's a bit more radioactive and it travels a bit further. So it was why the best option was the briefcase. The gamma and X-ray cookie, um, eating it would be the best option. Because basically it's highly penetrating, it'll travel through the body and not be absorbed in the body. Therefore, it would be less dose to us. So you would be able to eat it, but the body would not absorb the cookie, so that would be less dose. And then last, throw the neutron cookie, throw it away. You don't want that cookie or that emitter around because it is most radio sensitive. It is the most radio sensitive out of the four cookies. So good job with that from last week. Okay, let's switch over to tonight's presentation. So tonight we are going to talk about effects of radiation. But first, before we get into, we gonna just do a quick review of some factors that influence the effects of exposure to radiation. So one factor is the total dose received. And when we look at total dose received, a couple of measurements that we look at are absorbed dose. This is how much radiation is absorbed by the person. Effective dose. This is used to compare harm based on the radiation type and the tissue type. And that helps us understand the risk of long-term effects. And then lastly, equivalent dose. This is used to compare harm based on the radiation type. Then the type of radiation depends on the exposure as well. Is it X-ray? Was it gamma, alpha, beta, proton, and neutron particles? And then also the tissue type or the cell sensitivity. Depends on, specific type of type. It also can depend on age, biological sex, exposure rate, and exposure type. So first, we're going to get into somatic and genetic effects of radiation. So ponder this for just a second. A patient comes to the radiology department for a routine fluoroscopy exam of the esophagus. Will the radiation exposure they received affect the patient or have future biological implications? If somebody could come off mute and tell me what you think would be the outcome of that exam. Any takers?
They could possibly get cancer down the line.
Yes. So it's kind of with this, you really you don't know. So with any radiation exposure, there's a chance, but we really don't know. And it's gonna depend on a couple things. It's gonna depend on what was irradiated. It's gonna depend on the type of radiation. It's gonna depend on the amount over time. So more than likely, If a patient just comes in for a routine esophagus fluoroscopy exam, um, the effects that they're going to have are somatic effects. And that means that basically it's affecting them. So it basically affects the person or the body that's being irradiated. But there is a chance that cancer, uh erythema, which is the skin, the redness of the skin, skin rash, cataracts, blood damage, that is a possibility. But due to that individual exposure. But then you compare it to genetic effects. And so what this is that it may have some type of damage in the future due to the type of cells that were irradiated. Um, so those genetic effects down the line may be developmental abnormalities, specific type of mutations, malformations, metabolic disorders, and immune deficiencies that could potentially come from the exposure. So when we look at somatic tissue reactions, um, as the dose the patient receives increases, the severity of our tissue reaction is gonna increase. So basically, as we increase the dose, the possibility and severity of what could happen increases. We have early effects. So what's the time frame? When did it happen? How long did it happen before the person may have experienced some type of reaction? And we look at this as being deterministic. So deterministic is predictable. So we know that there are certain things that happen with response to radiation or exposure to radiation to certain body parts. So we know potentially we could have cataracts because of radiation exposure. Um, Depending on what, the amount, we could experience hair loss, decrease in sperm cell, the skin erythema. So that's only gonna occur at a specific dose. But then you may also have late effects. Your late effects are gonna be your random and unpredictable effects. So basically, you know, we know that if you get exposed to radiation, there is a chance that something will happen. But the stochastic effect means that at some point, because of the radiation exposure, you may experience some type of reaction or some type of issue like cancer. But there's really no way for us to know that. So some other genetic effects that can happen from being exposed to radiation uh, are hemophilia, Huntington's, chorea, Down syndrome, Duchenne's muscular dystrophy, sickle cell anemia, cystic fibrosis, and hydrocephalus. These are all spontaneous mutations because we know we do know that sperm cells and those cells that are rapidly dividing are going to be a little bit more sensitive than some of the other cells. Um, and these mutations happen in about 10% of all the live births in the US. And they're basically biological consequences of being exposed to radiation. So we understand that, when we image pregnant patients, if you ever had the image of pregnant patient, that it should be in a case where it's risk versus benefit. So, you should only do it if it's necessary to save that person's life or if they have something that's affecting them going on. But we know that number one, the first trimester And that means from week 1 to week 13 is going to be when the cells and that fetus is forming. That's when it's going to be most radiosensitive. So basically, it kind of breaks it down for us. So 0 to 9 days, if you have exposure during this time, you can have lethal effects. And that can happen up to exposure of 100 milligray. Organogenesis, if you're exposed between 10 days and 12 weeks, malformations may occur, most likely will occur, and then physical deformities and growth retardation can occur. And then once we get to that 12, 13 week mark, approximately, or 12 weeks, approximately to 40 weeks, the fetus could have cerebral effects. So you can have some type of brain growth or brain damage. So affecting brain growth and brain development. So early and late effects of radiation. So when do effects of radiation exposure become evident? So we had our first case study, which with this patient, we really wouldn't be able to tell the effect. We know that there is a possibility that person, because they've been irradiated, that it could affect them as an individual, but we don't know if down the line it's going to affect any type of genetics. So the next example, a patient comes to the radiology department for a routine fluoroscopy exam of the esophagus. A few weeks later, the patient receives a cancer diagnosis and claims the radiation they received from the routine fluoroscopy exam caused the cancer. Was this enough time to cause effects? So somebody come off mute and tell me if you think that was enough time, or what your thoughts about this case study.
No, it was too short of a time.
Okay. Yeah, I would tend to agree with you on that. Um, like I said, we know there's a chance that something can happen. But usually if something is going to happen, it's not going to happen within a few weeks of having an exposure, especially not with x-rays, because our x-rays are more low dose. Now, if the person was having being exposed to some higher dose radiations, like your neutrons, maybe even alpha or beta, they could potentially start seeing things a little bit sooner, but not as soon as 3 weeks or a few weeks after they've had that exposure. So early effects usually are going to manifest hours or days after the radiation exposure. So what will occur with these early effects is you may see skin burns, hair loss, epilation, diminished sperm count, infertility, and acute radiation syndrome may occur. Those are usually early effects if you are having a large dose of radiation at one time. Late effects or delayed effects or radiation exposure can manifest over years, and it could potentially cause cataracts and cancer. So with those late effects, because it could potentially happen down the line when there's nothing happen, that's kind of caused, that's your latency period. So you've had this exposure and you know you feel fine, nothing's going on, but at about the 5 to 7 year mark you get diagnosed with leukemia. So that's one of the outcomes of having a large dose of radiation at one time, that eventually, because of that exposure and the type of radiation, that you may potentially develop leukemia. On down the line, 10 to 60 years after the exposure, you may end up with some type of tumors or some type of cancer. Like I said, really, there's really no way for us to know and for us to tell. We can try to predict this, but we just know, as being taught in school and being taught about radiation, that any exposure could potentially cause some type of harm or damage. And it doesn't necessarily mean it will show up, because sometimes, depending on what was irradiated, the body can recover and repair itself. So then we're going to move on to deterministic and stochastic effects. So what type of damaging effects occur after receiving a specific dose of radiation exposure? So next case study, a patient comes to radiology department for a routine fluoroscopy exam of the esophagus. What effects can we predict, if any, will result from the radiation exposure the patient received from this specific exam? This depends on the dose. So usually patient comes in for a routine fluoroscopy exam. We do all the proper shielding. We do all the proper things with the machine to reduce dose and limit the time. More than likely, nothing's gonna happen. So the patient is not gonna have anything that we can see that's going on. Now, depending on the area, because we know the neck is a sensitive area, there may be some type of reaction. So, but you wouldn't be able to see it right then. And then your stochastic effects, kind of like we talked about before, is going to be on down the line. So with your deterministic effects, if you have a specific dose, if that specific dose threshold or specific dose amount is reached, you could potentially experience the skin burns, hair loss, and all the things listed that we talked about on the last slide. The stochastic effects basically occur. No minimum dose has happened, and it's just random. So we have a table here to kind of show us deterministic effects occur after a specific dose threshold. So after a specific dose has been reached, then there may be some type of effect. The table shows us at about an exposure of 150 milligray, someone may experience, or males may experience, diminished sperm count. At a dose of about 2,000 milligray, you may experience skin erythema, and then at about 3,000 milligray, you experience epilation. This is going to be, you experience that at one time, so one whole dose. Deterministic effects are also called non-stochastic. They can be called tissue reactions, or they can be called threshold effects. So we see with stochastic, our table shows us that basically with any radiation dose, there's a possibility. We know that being exposed increases the possibility, but it's not going to be certain that that's the cause. So with stochastic effects, there's no minimum dose. So at any dose, there could be some type of reaction or cancer, but we can't tell that. It's unpredictable. So any dose can cause cancer. Yes, potentially it can. But we know that it really depends on the amount you get, the type that you get, and then the different type of tissues that are being exposed, and how your body is absorbing it. So depending on those three things, that's going to determine whether you can experience cancer. But we know anytime we're exposed to radiation, there's a possibility that cancer can develop. With x-rays, it tends to be on the lower side, or you can kind of say more than likely it won't happen because our radiation is not as penetrating and is not as I won't say strong, but you have alpha radiation and the neutron or radiation that's gonna be a little bit more intense than the X-ray radiation. So next we're going to talk about acute radiation syndrome. And so we saw that acute radiation syndrome can happen if we are exposed to a specific dose at one time. So with acute radiation syndrome, three things can occur. Patient can experience a hematopoietic syndrome, gastrointestinal syndrome, and or cerebral vascular syndrome. So we know the areas of our field, the modalities that are ionizing or radiation producing are, of course, radiography, CT, mammography, fluoro, and nuclear medicine. Acute radiation syndrome will often result in death. The entire body has to be exposed for this to occur at a high dose. It's very unlikely with diagnostic imaging. And you will see this more with possible or nuclear accidents. Those types of accidents where people are exposed to a large amount of radiation, specific type of radiation at one time. So what most likely can happen from being, from having any type of exposure, number one, cancer. It's very unlikely because we know that, it doesn't matter the dose, it could potentially happen. With ARS, the most unlikely effects are deterministic, which if you have a big enough dose at one time, you may be able to see early effects. And the threshold is many times higher than the dose in the medical imaging. So the dose that we give patients, a patient would need to experience a way higher dose to start seeing ARS or ARS symptoms. So with the hematopoietic system, if it is affected, basically your bone marrow is destroyed. And then you have inadequate blood cell production. This could lead to anorexia, fever, or general lethargy. And possible causes of death would be infection, so absence of white blood cells, or hemorrhage, absence of blood clotting agents. And we can see a hematopoietic syndrome can occur at least one grade exposure at one time. Gastrointestinal syndrome, basically the GI tract is destroyed. This leads to diarrhea and dehydration. Possible causes of death is that dehydration, basically the body's inability to control water absorption, and then electrolyte imbalance, the body's inability to control the electrolyte absorption. Gastrointestinal syndrome can occur at least a 10 gray dose at one time. Then we have cerebral vascular syndrome. Basically, it's going to be damage to certain parts of the brain. This can lead to convulsions, even coma. Possible causes of death are unknown. Cerebral vascular syndrome can occur at least 50 gray, exposure of 50 gray at one time. So acute radiation exposure or acute radiation syndrome, the disease, it does progress. So when originally or that first initial exposure, you could start to see symptoms between minutes to days, and they could vary from anorexia, nausea, vomiting, or diarrhea. Then you go into phase 2, which is the latent phase. So you may experience some of these early conditions, but they seem to be getting better. And they seem to, have kind of calmed down or gone away. Your latent phase is going to be related to the least amount of dose that you get, the increased latent phase that you will have. The increased dose will you may not experience a latent phase. So if you have a large dose at one time, depending on the dosage, you may not have a latent period. You may go from the prodromal to the manifest period. So next period is phase 3. This is where you have a full systemic illness. And then phase 4 is either the body is going to be able to recover and repair, or you'll end up dying from the exposure. So lethal dose, the term lethal dose. So in this equation, you see LD 50/60. So the 50 means that if lethal dose of 50% if the population is exposed to a lethal dose, 50% of the population exposed to a lethal dose, then within 60 days, they will experience death without any kind of medical intervention. So lethal dose of radiation that will kill 50% of the population within 60 days without any medical intervention. So a human's lethal dose is going to be between 3 and 4 gray. So that's kind of when you see that LD, if you ever see LD 50/60 or LD 40/50, that's how you kind of interpret that. So next we're going to talk about linear and non-linear dose curve responses. So what does this look like on a graph if we were to graph reaction? So versus a reaction that has no a radiation exposure that has that could potentially cause damage, but we don't know. But then we also know that there are conditions that can happen once a certain dose is reached. But what does that kind of look like from a kind of a graph representation? So a patient comes to radiology department for a routine fluoro exam of the esophagus. What effects can we predict, if any, will result from the radiation exposure that the patient received from that exam? So can anybody kind of tell me their thoughts on that? If the patient comes in for a routine exam, are there any effects that we that may result that we will see? Any takers? Okay, so we have linear non-threshold, and we'll talk specifically about what linear non-threshold means. No effects will be seen. They will likely be late effects. Yeah, pretty much. So if the patient comes in and has a routine exam, we're probably not gonna see any type of response, because number one, the type of radiation the patient received. Number two, the amount, and number three, what area. So we're probably not gonna see anything. The patient's not gonna probably see anything. So when we hear the terms linear versus non-linear, that's the term to the graphic representation. So linear just means you have a straight line on this curve. So you see with line 1 and line 2, there is a straight line. So with a linear response to radiation, is directly proportional to the dose you receive. So we see here with our blue line that our bottom line is radiation dose. So that's telling us where it starts, that with any exposure to radiation, there is a possibility that they can have some type of response. Number 2 shows us that as we kind of go down on the radiation dose curve, that at this certain point of dose received, then there may be a response to radiation, or we kind of know already there will be a response to radiation. And then same thing with our green curve. It tells us that at this specific dose, there will be a response. But the response is going to vary, and it's going to depend on a couple things. So then when we hear the term threshold versus non-threshold, so our threshold means that no biological effect is gonna happen below a certain point on 2 and 3. So and then with our non-threshold, it tells us that any dose can cause a biological effect. So an expected response, regardless of the dose, is non-threshold. So our lines 2 and 3 tell us that no matter, regardless of that dose, there's going to be some type of response. So linear non-threshold, linear threshold, and non-linear threshold. So with our linear non-threshold, which is going to be our blue line, it basically tells us that no level of radiation is safe, because it's telling us at any dose, a response to that dose can occur. And the degree of that response is directly proportional to the amount of radiation we receive. And that response could be a genetic response or genetic damage or stochastic. Then our second line, linear threshold, it tells us at a low dose, at a specific low dose, you may not necessarily have a response, but when this threshold is reached, then the response is going to be directly proportional to the dose received. So when we get in this area, we're saying, possibility, don't know. But when we hit this area, it's telling us that more than likely it's going to be a response, but it's going to depend on the amount of dose we receive. And then our last line, non-linear threshold. That means at a lower dose, you won't have a response. But when you reach a specific threshold, the response is not going to matter about the dose received, but it will be some type of reaction. So it could be early tissue reaction. It's going to be some type of reaction to what you've been exposed to. All right. So that's all I have for you guys tonight. Do y'all have any questions about what we went over? I tried to go through it and wrap it up as fast as I could so you guys can get out of here, because I know you're trying to get ready for Thanksgiving. All right. If you don't have any questions, then you can go ahead and type your name in the chat box. And is this week's quiz also written answers? No, there are no written answers on this week's quiz. All right, guys, y'all have a good evening and happy Thanksgiving, everybody.